Welcome back to another episode of Voices of Dental AI. My name is Lauren King, Chief Evangelist for Trust AI. I'm here with Dr. Ankur Khanna. We are at the AAID conference in Phoenix, Arizona. We are having a blast. This is day three.
Yeah.
We have met amazing people, and we've actually had a lot of people come up to us and Dr. Ayer asking about Trust AI and what we're doing. So it's pretty cool to be here
That's
in
awesome.
person and seeing everyone getting the word out, right?
Yeah.
All right, so let's dive into who you are as a human.
Oh gosh.
So today I'm sitting down with someone who perfectly blends artistry, leadership, and innovation inside dentistry, and does it with a level of intention you don't see often. Dr. Khanna is an implant and restorative dentist, a global shaper, a World Economic Forum member, and honestly, just one of those clinicians who deeply understands that technology only matters if it elevates the human sitting in the chair, which is the most important part, as we all know. What I love about Dr. Khanna is that his entire career has been built around patient-centered outcomes. Whether we're talking about full mouth rehabs, all on X, aesthetics, it doesn't matter. But what's always built on that is comfort, education, and making the patient feel safe. What makes him especially powerful in the AI conversation that we have here at Voices of Dental AI is that he approaches it the same way. AI is a way to remove friction, sharpen decisions, and support the multidisciplinary care he already believes in. So thank you for being on the show, my new friend.
Thank you so much. That was a wonderful introduction.
Got you. Okay, let's dive into this. Ready? All right. So you're known for combining aesthetic outcomes with really strong clinical research and business development roots, right? You would say, I would say too. Okay. So when you think about bringing AI into this world, what was the first gap that you saw and what wasn't working in dentistry that made you go, okay, we need smarter systems?
So I'm a traveling implantologist, which means I go to many practices and do their surgical workups and do their surgeries and also help them with their full mouth rehabilitations. So what I've noticed across the board is that every office has a lot of segmentation, which means when the patient walks in through the door, the front desk is checking their insurance. That cuts into the appointment time.
Mhm.
And then the patients are taken back to the chair, and then the medical history is given to them to fill out, which cuts into more appointment time. And because of that reason, it leaves very little room for the provider to actually do their work properly. So I feel like it's like everyone from the front desk to the back is speaking different languages and trying to communicate with each other. So what I noticed with Trust AI is it can speak the same language throughout,
Mhm.
which I love, which is something which was much needed in the field of dentistry.
Absolutely. I think that it all just puts us on the same baseline, the same foundation, the same education, no matter where we went to school, no matter how we were raised, it doesn't matter. AI doesn't wake up and it's not in a bad mood because it didn't not sleep well
Right.
last night or
Yeah.
something like that, right?
Yes, that's true.
I
Very
agree.
true.
One thing you and I talk about a lot is that AI shouldn't feel like tech necessarily. It should feel like better care. Would you agree?
100%. Yes.
Okay. So, in your full mouth rehab and all on X cases, where do you see AI being the most helpful for patient comfort, predictability, and decision making?
That's a good question. I think in all components of that, I feel like, well, all components mean from planning. Well, the patient intake, medical history, then goes into planning, and then goes into procedure. So all these things need to go right for me to do the procedure perfectly, right? In order for me to do that before Trust AI and before AI integrated into dentistry, it took me hours to do this. Now with this, I can literally use Isaac for everything, and it does it within a matter of seconds. I'm actually presenting on it today
Mhm.
about how it kind of shortened my time frame of treatment planning and looking into the patient's medical history, down to evaluating the CBCT X-rays or 2D X-rays, and then just coming up with a treatment plan with different outcomes based on research data collected from many resources that we have to find logins for, find, subscription for and everything like that. So it really cut down my treatment time to within minutes than hours, which I love. I was actually telling one of the co-founders of this company, Divian, that I would compare this to Jarvis, the AI from Iron Man.
Yeah.
So I feel like it's very much like that. So I feel I'm not saying I'm Iron, but I am saying that Isaac is like Jarvis. It's really, it cuts out all the busy work and just helps provide a focus on what's important.
Absolutely.
Patient care.
Absolutely. Okay. I also know that you're huge on collaboration. So that means surgeons, restorative, lab, teams are all aligned all around,
Yeah.
right? Okay.
Right.
So AI is basically built to orchestrate that, as we know.
Yeah.
How do you see AI improving communication between the people involved in a case?
That's a very good question. I think on different levels, there's so many different teams involved. Like, let's talk about X. If we talk about, from the time the patient walks in to I'm involving the lab to help me build, let's say if I'm doing a fully guided X, I have two different lenses. One that's building the surgical guide for me. Two that's building the temporary and the final restoration for me. And in the middle, I have to communicate with the patient's family. I have to communicate with the physician of the patient because we're going to be doing IV sedation. So all these different components need to come together, right? And then with Isaac, what I noticed, I mean, it was basically I put all the data into Isaac, right? It was helping me filter out all the relevant medical information for the specific procedure that I'm doing and cut out all the fluff, right? The other company or another lab that I use to evaluate my CBCT or help me plan the implants in a 3D manner, Isaac can do that within seconds. Okay, great. One more thing cut out, one more less phone call or another thing I need to schedule, which is done. And coming into then, once I've done the treatment plan, executing that, and then giving when I'm doing the procedure, I have to write treatment notes. My assistant's writing while I'm talking. They tend to miss things. It's the human error, right?
That's going to happen.
Exactly. So with Isaac in the room, it's recording everything I'm saying and notating that, which becomes a medical legal document, which I want everything that I'm saying to the patient to be recorded. And that does it really well. Then when I'm doing the procedure and let's say if I'm putting in local anesthesia, let's say at 9 a.m., right? If I'm doing that, I'm saying that out loud so that my assistant can write it down, but Isaac is listening to me. And then if I'm injecting more local anesthetic at 1 p.m., Isaac is listening to me. When I'm doing IV sedation and I'm, administering any kind of anesthesia, he's listening again. So, it's fantastic. But I don't have to worry about, hey, did my assistant get that? I don't know. Right. This is just great. It kind of shortens my, stress levels during the procedure.
Which I feel like when we're talking about humans, anything that can reduce stress means there's going to be better outcomes for our patients.
Absolutely.
We're less likely to make mistakes.
Yes.
We are less likely to buckle under pressure because we're not as much under pressure. And I think that also translates to our staff, the labs, everyone involved, right?
Correct.
Okay.
Even when I want to do, like, let's say if I see a patient and I want to give them post-operative instructions, or if I want to give them a referral to another dentist or another physician of some finding I found in a 3D X-ray, which Isaac will point out for me, just in case I miss it, which is great. It'll write a report, which is amazing. I don't have to worry about that and then hand it to the patient later on or tell my assistant to do it. Cuts my busy work, which is amazing.
Right.
Yeah.
Awesome.
Yeah.
Okay. Let's go into more of the leadership and global perspective. So you've worked with the World Economic Forum,
Yes.
correct?
Correct.
And you lead initiatives for underserved populations.
I do my best.
How do you see AI closing gaps in access to care? What problems does it actually solve at a community level that we don't talk about enough?
I think one of the biggest things is the language barrier, right? Everyone in different countries communicates differently, right? I think with artificial intelligence, you can close that language barrier. I think that's a key component. The other thing is access to data, that artificial intelligence can get to anybody who has just a computer or a phone, right? Which is amazing. I know people talk about, you can just Google that or ChatGPT it.
Doesn't mean it's right.
Doesn't mean it's right. Google and ChatGPT tend to go down its own funnels. But what I've noticed with Isaac, like you were saying earlier, what was it you were saying?
Which part?
The error rate is less than 0.1%.
The hallucination rate is under 0.1%.
Which is phenomenal.
Right.
That's
basically zero.
That's basically zero. It's better than any human or any other system can do, which is amazing. I mean, if it can do that, it's going to have less errors in translating things into different languages. I think it gives me more confidence that I have someone or something to rely on that I can actually count on.
Yeah.
Instead of just guessing that, is the AI correct or not?
Right.
Amazing.
And I feel like it's also the part where people get super hesitant too. They're like, well, we can't just trust it blindly. And I don't think that you should trust anything blindly, including yourself, right?
Right.
Your instincts are going to be different case by case,
Yeah.
human by human that you're working on. I don't care who you are or how perfect you are.
Yeah.
Some patients are going to cause you to slip up because they're going to challenge you, whether that be because they're a combative patient, whether that be because they're uncomfortable, they're scared, whatever it is. But if you know that you're trusting a source that has probably done better than you did on your own national dental board to the second, right? Well, when did you take your national dental board?
Probably I don't even know. It's probably over a decade ago.
Exactly.
So,
And I want to humble you by saying, I'm sure you don't remember every single thing on that test, correct?
I do not. Yeah.
Okay. That's totally fine. You're a human being. You're not a robot.
Correct.
But having a co-pilot robot that does know down to 98% every single thing that is on that dental board to help you, I think is only going to cause everything to go in influx and grow in a very stable way.
Yes and no.
Tell me the no. I love no. I love no's.
Yes, it has the knowledge, the bookish knowledge of having all the data vetted into it. But every patient is different. Every situation is different, right? So, which is why I feel like it should always be used as an adjunct, not a replacement. Yeah. Not a replacement. Like you can't rely on any artificial intelligence to tell you, hey, this specific patient needs this. It can give you all the data and you have to be the deciding person, doctor, treating physician, or, like basically dentist or any kind of surgeon to decide, okay, this is what I'm going to do based on all the knowledge I've been provided, based on my research immediately in the chair side.
Exactly.
As opposed to, give me a few days, let me work on a case and come back to you.
Exactly.
I'm not saying about every single case, but like more complex cases, you want to think about it. You want to ponder over it.
Absolutely.
Think about all the options you can do. Think about what the patient wants.
You want to sleep on it.
You want to sleep on it. But you want to work at it. Exactly.
Exactly.
So that's the no part.
Okay.
Which is, I feel like the responsible use of AI is very important as opposed to the overuse of AI.
I accept that no.
Thank you.
So, all right, let's go into more of the business and clinical efficiency side of it. So you have that rare blend of clinical skill and business development. How do you think AI is going to reshape the actual business model of a dental practice? Not hypothetically, but actually realistically.
I think what it's already doing, there's other companies who have come out with, I think, what they're claiming to be artificial intelligence. I'm sure that they're, to a certain extent it is.
We had to start somewhere.
We got to start somewhere, right? I mean, even Isaac is in the baby phase.
Right.
What's
We're in
happening?
beta.
Right. Beta testing. But I think there's so much of human error, like I was pointing out earlier, about there's so much segmentation in the flow of dentistry in a day-to-day schedule that I feel like this shortened it quite a bit. I've had my back office staff who works on insurance use Isaac every single day. And they've told me they've gotten like probably twice or three times more done in that same amount of time, which means as a business owner, you're paying people hourly, right? And they're doing 3 times more work because they have something to help them do their job more efficiently. Right. Which means they get raises and they get bonuses because something's helping them.
And they should.
And they should.
Yes.
Which is great. And that's incentivized, right? So that's how it should be. Like you get more work done, you should be incentivized to do so. Right. But, and also in the same note, they feel less stressed out. That they're not coming into work dragging their feet. They're like, oh yeah, this is easy. I got this in the back. Which is amazing.
Right. I love that.
Yeah.
I love that perspective.
Yeah. Help the people who are helping you.
Absolutely.
Team.
Absolutely.
Yeah.
Take care of the team.
Makes the teeth work.
I like that. I was like, I heard this. Where is he going with this? No, that's different. That's different. What's the other one you said the other day? The one that you need to trademark?
Oh, okay. Which one? But there was a couple of them.
The one where you were saying that it's
changing the world one smile at a time.
That one. Yeah, I like that one. All right. So speaking more into trust and the conversation around trust. So one thing we hear from dentists all the time is fear.
Yeah.
Fear of liability, fear of losing control, fear of bad data. You see AI differently. How do you build trust with technology as a clinician?
So there's different components to this. One component is, yes, there is a lot of fear around, am I doing this correctly? Am I recording things correctly, right? And that that there is a miss in when you do procedures and you're running between 3 rooms, doing 2 hygiene checks, doing your own, procedure at the same time. And how are you supposed to, like you said, we're all human beings.
It's going to happen.
How are you supposed to remember every single detail you spoke to 40 patients in it at a time when you're doing like 20 hygiene checks? I think when I'm going from room to room and doing these procedures, I have my assistant have, Isaac on my phone, and they're just recording everything, and it's notating everything down. So that at the end of the day, when I'm sitting down and making sure all my notes are in there, I can just look at that and copy and paste it, and maybe do some edits, obviously, just to make sure that I have all the information in there. But it's just recollecting for me what I talked to the specific patient about, and also becomes a record for any future, medical concerns or legal concerns that they might have. There's so many patients who walk in and they have 10 different medications that they talk about. Yes, they're supposed to update their medical history, but they never really do this, right? Like,
No.
Exactly.
Sign.
And then when you go through each and every single one of them,
Oh, yeah, I do like that. I do take that medication.
Exactly.
You had a heart attack last year. Okay.
And I'm supposed to do surgery on you, so I need to know everything exactly how it was, right? So that helps me quite a bit to reduce my stress. Or every single dentist I've shared this with, they've all said the same thing, right? What else did you ask me?
How do you build trust with technology as a clinician?
So one of the things that patients always feel is that when I'm talking about, or whenever we are talking as a team about treatments, they feel like we're trying to sell.
Some docs trying to buy a new Benz.
Right, exactly. So in order for us to make sure there's no bias in the situation, I let them talk to Isaac. I have it on my phone. I'm like, here, ask it questions. Ask it whatever you want.
Right.
And they're like, well, this just seems like your own AI. I'm like, okay, that's okay.
Yeah.
Why don't you do the same? Why don't we do the same thing with ChatGPT? I've actually done this with.
Oh, you've compared it.
I've compared it in front of patients. I'm like, okay, let's ask the same question to ChatGPT and Isaac, 2 laptops. And they were astounded to see how detailed Isaac was compared to ChatGPT, and the references it was pulling up.
Right.
And they didn't, even though they didn't understand the details of the references, but I was kind of telling them, hey, this is legitimate. This is legitimate.
Yeah.
Because as a dentist, we have to spend hours to get those references, to get those updated data. We have to keep up with everything, and this helps us do that.
It's not like it's all in one place.
No, exactly. Okay. But this brings it up.
Yeah, it does.
Yeah.
It does.
Yeah.
I love that.
Yeah.
Okay. So when we're speaking about the future, if you could design the perfect AI supported workflow for restorative and implant dentistry, what would that look like? What do you wish existed?
Well, I think Isaac and Trust AI are on the right track. And you start by saying that. There'll have to be many more improvements, obviously, but that's just the nature of the game. I think patients should have access to something like this on their own time. And I feel like that'll build a lot of trust. If I see a patient and I'm like, hey, this is what I'm using, why don't you take this home? Talk to him. Get back to me. Ask me questions.
It's like a patient mode.
Patient. And if this is on, the practice's websites even, that would be great too. Where it's not just a chat bot, it's actually communicating back and forth with you, or literally like artificial intelligence.
Right.
As opposed to just something that's spitting facts back in.
Absolutely.
Which I think
it's critical because patients don't trust us.
Yeah.
They don't like us.
Yeah.
They don't associate the mouth with the rest of the body.
Yeah.
And neither do we, if I'm being honest.
Yes.
Not as well as we should.
I think we need to do better.
We're conditioned just like they are, that we're separate, right? And I think that if we educate as much as possible, and we start creating that urgency around, no, the mouth is actually the communicator for your entire body. So we're talking total body health, not just from your neck down.
Right.
Or your teeth up. Right? So I think that when patients feel more inclusive in their own health, they take better care of their health. But when they actually understand the urgency, the education, the systemic link to all of this, and they're learning it from their own perspective, I think that it does build that trust between, okay, my dentist isn't out to make a money pit out of me,
Get-
right?
Get a quick buck. Yeah.
AI has no skin in the game.
Right.
It's not going to make an incentive if you close a case.
Right.
It doesn't care about any of that. It's trained and trying to think intelligently like a human
Yes.
without the emotional barrier that we have as humans, which
Or
is
the biases that are
or
related
the
to that.
biases, right? Or we didn't sleep last night, or our staff is all having a really bad day, so we're just trying to put all the fires out. Whatever it is about being human
Yeah.
that is so difficult, I think AI, our patients, and ourselves can become a cohesive unit the more we embrace each component altogether.
I 100% agree with you. I think to add to that, I would say back in the day when no one had access to Google or any kind of data, as much data as people have right now at the click of a button, I think it was a different story where patients were relying on their doctors to tell them the right form of treatment. Now it's more like, okay, my doctor told me this, let me just Google it very quickly. But access to the right data is important, not just any data that's out there, right?
Correct.
So this is what like artificial intelligence in dentistry should separate that. And I think that's why Isaac and Trust are on the right path. I'm sure there's going to be other companies that can be doing this. And that's amazing. I think they should. But it's very important to have the right data to share with the patients as opposed to just letting them figure it out on their own.
WebMD told me this.
WebMD, Dr. Google, to avoid that.
Right.
It's good to guide them in a certain direction.
Absolutely. I'm so glad that we got to do this episode and do it in person. I just want to thank everybody for watching. This is Voices of Dental AI. We will see you on the next episode. Here is how you can find Dr. Khanna if you want to contact him.
You can contact me on LinkedIn. I think I can share that with you.
Yep, I could share it.
And also on Instagram as well. It's AJ Khanna, KHANNA @gmail.com.
All right. Call him if you need him. See you guys next time.